Hi guys, long time no see. Last time I was on here, I was giving you an update on my first and second beta. My first, which was 9 days past 5-day transfer, and it was 193. If you see me looking down, I'm looking at my phone. 9 days past was 193. My second beta, which was 11 days past, was 383. And then my third beta, which was at 14 days past 5-day transfer, was 1913. We did have our first ultrasound on 10/28, which was at 5 weeks, and there was one visible yolk sac. And at that time, the doctor did tell us to discontinue the progesterone and oil shots, so no more of those. Stop taking the aspirin, and then we started doing the endometrium vaginal inserts. So that's good to be away from some needles. We're still on the estradiol valerate injection, which is just on Mondays and Fridays. I'm still using the patches, changing them out, 4 of them every 2 days. Also, so as far as symptoms, I've been having a lot of breast tenderness, constant cramping, not all day, but it has been since the beginning of, the transfer. It's just been on and off throughout the day. I have been having constipation. I've been trying to increase my water intake to combat that. Also, I've had nausea here and there, not really, a lot to complain about with that one, but then I've been having a lot of heartburn and thirsty all the time, like constantly. I'm always putting on lip balm and just trying to do whatever I can to stay hydrated. So, on sorry about that, guys. So I went to grab my ultrasound so I could show you. So this is our ultrasound from 5 weeks. Let's see, it was 5 weeks, 4 days. Yes, so 5 weeks, 4 days. This is the little sac, and the yolk sac is there inside of it. You can barely see it. I will admit, though, we had a bit of a scare. So we had our second ultrasound scheduled for 6 weeks and 3 days, 6 weeks and 4 days. But on last night, so on last night, November 3rd, about 2 a.m. in the morning, I woke up to go use the restroom, and was a tissue full of TMI blood, and it scared and freaked me out. I didn't want to immediately go and let hubby know, but I knew that I would probably call a doctor in the morning and want to follow up. So I laid in the bed for about 30 minutes trying to watch TV, trying to calm myself, trying to say some prayers and just, relax myself. And then at that time, he just woke up on his own because I got up to put a pad on because I just didn't know what was going on. I put the pad on and I used the restroom again because I've been, like I said, frequent urination, like every 2 hours I'm going. And I went, and that time when I wiped, it was kind of pinkish, so it had lessened a little bit. So get in the bed, just crying and praying, and he turned over. He was like, "What's up? What's wrong?" And I said, I went to the restroom and I saw blood." So he gets up, and then he's nervous and scared, and we're praying and crying. And so this morning, as soon as they open, I think they open at 8. I called that like 8:04, and they told me to come in this morning. So we were scheduled for our 6-week and 4-day ultrasound on tomorrow, but I went in on today at 6 weeks and 3 days, and they went in, and thank God they found a heartbeat. So I have an ultrasound from that. This is what we have. So we have at 6 weeks, 3 days today, our yolk sac, and baby is here. We got a heart rate of 103, and right above the baby, they see this here. Is this upside down? Yeah, it is, but it's fine. They see this here, and then the ultrasound tech says that it looked like it could have been a blood clot. So they're thinking that that could be the reason for the bleeding. So the doctor did let me know that from using the progesterone inserts and some of the estradiol can cause cramping and sometimes bleeding, so they didn't really seem too concerned about it. But however, as the ultrasound tech began to pull the vaginal probe out, she said, "Wait a minute, what's that I see?" And this is what we saw. So it looks like there's another sac that they did not see on last week, and the piece of it that she saw today, she hadn't zoomed in, I guess, and you couldn't really see it too clearly. So now we're thinking that there are two sacs there. So this is the one they saw on last week, which is a little bit bigger. This one's a little bit smaller, and they didn't get a heartbeat in there. So they said by next week there should be a heartbeat, and if there isn't, then they would consider it non-viable. But right now they do see a yolk sac in there, just no heartbeat. So we shall see on next week. That is my update at this point. So that is for weeks 5 and 6. Just continue to pray for you guys, and ask that you pray with me as well. And everyone here trying to conceive, because it is a struggle. It is a unique struggle that many don't really, know how to deal with or know how to experience. Sorry, I think they're cutting grass outside. Yeah, so I was waiting for them to stop cutting right by the window here. So, so like I said, it's a unique struggle, a unique journey that very few are aware of. Well, I can say very many are on here. And watching you guys and your experiences, like I said, is just beyond supportive. There are some changes he made to my therapy. Tomorrow is my last estradiol injection. So at 6 weeks and 4 days, we stop injections. This last injection, and starting Saturday of this Saturday this week, which would be 6 weeks and 5 days, we will be doing estradiol by mouth, and just the patches and the vaginal progesterone suppositories. And he said next week we should be able to stop the patches, and we have another ultrasound on next week to check for the heartbeat of the second sac that was found on today, which may explain some of the bleeding. We're not really sure what caused it, but he told me to just go home and take it easy. So I called off today so I can sit here and do just that, just lay here and be a lazy, couch potato. I just want to just to take the time to just let everyone know that I keep you all in my prayers. I mean, if I can't call you out by name, God knows my heart, and that my prayers are out for you all. I ask that you continue to just, support me, and keep me in your prayers, my family and I, as we're going through this. And just appreciate you all, and I will be giving you an update soon. Again, this is update 5 and 6 weeks pregnant, and next update should be coming next week. I'll talk to you soon.